Look at what's going on. Oh, hello everybody. I want to talk a little bit about IVIG. I find this thing amazing, crazy, weird. I don't really understand it. So what is IVIG? It is intravenous immune globulin. We have all these immune globulins like you have your IVG and IgE and IgM and all this stuff. This is mostly IgG. So it's pooled antibodies, IgG mostly, pooled antibodies from 100 to 100,000 different patients. You suck off their plasma, you take out all these antibodies, and you put them in the IVIG bottle. And what can you use that bottle for? You can use it for autoimmune diseases, for example, like ITP, where you're chewing up your platelets. You can use it in somebody like that. You can use it in inflammatory conditions. Sometimes they'll use it in rheumatoid arthritis, for example. And you can use it for infectious disease. So somebody who has RSV, post-exposure prophylaxis. So it's an amazing kind of weird thing. And you'd use it at different doses with different regimens depending on what you're using it for. And you can also have sort of hyperimmune globulin for post-exposure prophylaxis I talked about, where you're specifically trying to get a lot of IVIG, or a lot of IgG, for things like hepatitis A, B, for rabies, for tetanus, for diphtheria, for botulism, for varicella zoster, for RSV, and cytomegalovirus infection. So somebody who's not immune or is under-immune, you can give them a big bolus of antibodies as post-exposure prophylaxis if they've got sort of cancer or something else. So there's a lot of ways you can use IVIG. One of the ones I always think about is with necrotizing fasciitis. There is some evidence that it works there. There's some evidence that it doesn't work, so it's a bit controversial. So you probably won't initiate IVIG therapy by yourself because there are so many different regimens. And so many different indications and new studies coming out all the time. So you'll probably be talking with rheumatology, with infectious disease about whether you should use it, but you should be the person initiating that discussion. Look, I got this patient down here and they have neck fas, and I think it's strep A because it's a young person and they don't have any other diseases, but they've got this. Should we be giving the IVIG? Talk to ID about that, for example. But remember, this is a blood product. It's associated with all the things that blood products can be associated with in terms of side effects, in terms of fever and all that stuff. But it is an amazing, amazing resource. Don't forget the IVIG. Herb it out.